With so many conflicting reports and rumors about the flu and flu vaccines, we understand that it's hard to know the difference between what is true and what isn't. In order to help our patients and parents, we have produced this video so you will have the real facts about influenza. Hi, Mrs. Howell. It's so nice to see you in Savannah again. How are you doing today?
Good. Actually, I was thinking about getting Savannah vaccinated against the seasonal flu and H1N1, and I've heard a lot of confusing information, and so I brought along some questions.
Why don't you tell me what's on your mind, and I'll be happy to give you the real facts.
Well, why do we even vaccinate against the flu? Isn't it just a cold?
That's a good question. Both influenza, or the flu, and the common cold are actually viruses. But unlike a cold, the flu is more likely to cause severe disease and in rare cases even death. Because it can be such a risky disease, a vaccine was developed to protect us.
So how do I know if I have the flu or just a cold?
Well, with a cold, you may get a fever, but more often you just have a runny nose or congestion with a cough, and it comes on very slowly. With the flu, it comes on suddenly, and you may get chills, aches, vomiting, and diarrhea. You feel very tired and very achy with the flu.
Okay, so then what's the difference between the seasonal flu and the H1N1 swine flu?
What most people don't realize is that there are actually many different strains of flu which can mutate slightly each year, so every year vaccine manufacturers have to modify the flu vaccine. So actually the flu vaccine is truly new each year because it's updated to protect against the newest circulating virus strains.
So the H1N1 is just a new strain of the flu?
Yes, as I was saying, flu strains mutate or change their identity a little bit each season, and occasionally we have a year when the flu virus changes even more dramatically. In the case of H1N1, the human flu virus actually crossed with virus strains seen in birds and pigs.
So that's why it's called swine.
Exactly. The H1N1 vaccine protects against this new strain of flu, and the seasonal flu vaccine protects against the three most common seasonal flu virus strains.
But wait, if the seasonal flu and the H1N1 vaccines are made the same way, then why didn't they just combine all four strains and make it into one vaccine?
The answer